talking about parasympathetic system or cholinergic system. So as I told you, parasympathetic system, it has fully cholinergic neurons, so it will secrete only ACH. Now this parasympathetic system, we also talked about the receptors. We talked about the receptors. What are the receptors? We have nicotinic receptors, which is present in the ganglion, and we have the muscarinic receptors, which is present in the organs. Now let me show you in brief. So yeah, nicotinic receptors in the ganglion. One, you have it in the neuromuscular junction, and another in the N is for present in the ganglion, NM is present in the neuromuscular junction. Muscarinic receptors, there are 5 types: 1, 2, 3, 4, and 5. Now one is present in M1 is present in gastric glands, stomach, smooth muscles, etc. M2 is present only in the heart, which is very important. M3 is present in glands, smooth muscles, urinary bladder, GIT, eye, pupils, bronchus, etc. 4 and 5 are present in CNS. Now M1 and M3, the muscarinic receptors are metabotropic receptors. I talked about nicotinic receptors or ionic receptors. It will allow sodium channels to go inside, right? Sodium ions to go inside, but the muscarinic receptors are metabotropic. These are G protein coupled receptors. So GQ, M1 and M3, M1 which is present in the gastric glands are GQ, so they are inhibitory type of G protein coupled receptors, so they'll increase the calcium channel. So they've increased the calcium, there's more of contraction and secretion. The same thing happens in G3, which is present in smooth muscles, glands, bronchus, etc. And M2 is present in the heart. They are GI type of receptors. They will increase. They are also inhibitory. They'll increase the potassium ion concentration, and so they'll decrease the heart rate. Since it's a parasympathetic system, the heart rate will be decreased. Everything will be at rest. That is one word you have to remember. Parasympathetic system, everything will be at rest. Okay. Now, yeah, so this is the muscarinic system. You can say it however you want. Muscarinic system, cholinergic system, parasympathetic system, everything is same. So everything is at rest. Heart rate will be decreased, bronchoconstriction, GIT, there will be more of peristalsis. Urinary bladder, you will have voiding. And glands, there will be more of secretion. Pupil, you can see pupillary meiosis, contraction will be there. Yeah, contraction will be there. So if it's given in contraction, it will be useful in glaucoma. In glaucoma, what happens is if you dilate the eye, it can close the excretory network, so they'll worsen the glaucoma. So when you contract the pupils, what happens is the angle will be more, or angle will be free, so that the glaucoma, it will be helpful in glaucoma, open angle glaucoma and angle closure glaucoma. For both you can give parasympathetic or cholinergic drugs. Okay, now what are the drugs we have to know? See, cholinergic agonists. First we'll talk about cholinergic agonists. These cholinergic agonists are of 3 types: direct acting, indirect acting reversible, and indirect acting irreversible. Indirect acting, it's like acetylcholine. We have methanacol, bethanacol, that. Indirect acting, what happened is this acetylcholine esterase will be inhibited, so that the ACH will be more in number. So that is how we find it. Now, yeah, so if you want to see this classification, let's find, see, ACH, methanacol, bethanacol, and all that. As an alkaloid, we can also find pilocarpine, which is also a cholinergic drug. And then we have indirectly acting. Reversible is the carbamates, irreversible is the organophosphates. This is what is going to cause poisoning. In reversible, we also have water soluble and lipid soluble. Water soluble is neostigmine, pyridostigmine, hydrophonium, etc. Lipid soluble is physostigmine. So this is what is cholinergic system. Now to be very brief, I'll talk in a very brief way. See, first, we'll talk about direct acting agonists. This direct acting agonist, acetylcholine, we know it's a parasympathetic system, right? So it will decrease heart rate, it will decrease BP, it will decrease heart rate, it will decrease BP, it will increase GI peristalsis. At the same time, it will cause meiosis. So yeah, but what happens is acetylcholine is rapidly acting, so there's no use of giving it as a drug. Now methylcholine, carbachol, bethanechol and all these are methylcholine is also rapidly acting, but it will more stimulate more on the M2. This bethanechol is very important because bethanechol it's acts only on M3, and M3 is present in all the glands, is present in the urinary bladder, etc. So M3, since it increases the contraction, it can be used in post-op urinary retention, paralytic ileus. But you should avoid an asthma because M3 is also present in the bronchus. So if you give, there will be more of bronchoconstriction. So for post-op urinary retention is the asthma, you should have to give tamsulosin. This tamsulosin is, now why are we giving tamsulosin? Is because tamsulosin will relieve the symptoms in post-op because it is also used for BPH, efficacious treatment in BPH with a little effect in blood pressure. So tamsulosin is much better option. Okay, so that is the direct acting agonist. I'll just show you the carbachol, pilocarpine. These are all used in meiosis, to cause meiosis, so that IOP pressure will be less. Bethanechol, we talked about urinary retention. Okay, indirect acting.